that is perhaps a critical aspect of the care of MS patients nowadays, that we have so many wonderful options. The question remains, what is the right therapy for the right patient at the right time, right? So the idea of precision medicine is hopefully a tool that can allow providers to narrow down the options for disease-modifying therapies in multiple sclerosis based on a variety of factors that includes clinical factors, MRI-based biomarkers, serum-based biomarkers, but also things like race, ethnicity, demographics. So we traditionally divide those factors into patient-related factors, treatment-related factors. So the patient-related factors had to do with, as I mentioned before, race, ethnicity, but also patient preference, right? So this should be a shared decision-making. So things like route of administration, frequency of administration plays a role. And also patients are very educated in the terms of risk benefits, right? So understanding what are the risks of certain therapies or interventions, it's important, particularly in the context of a pandemic. In terms of treatment-related factors, we look at the mechanism of action, whether it's constant or chronic immune suppression, whether it's immune modulation. Some options like the use of cladribine allows for intermittent immune suppression. So those are factors that are important to decide, but also the perceived efficacy of a medication and when to use that, ideally earlier in the course of the disease, and when to perhaps de-escalate or perhaps use safer medications that may not have a highest efficacy, but perhaps offer a good risk-benefit ratio in older patients.